Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. So many patients are very worried about calling the office in between their chemotherapy treatments, and they're wondering, when should I call the nurse? Which things are important enough to call? Well, by the time you have left from your chemo treatment, you should have a list that either you've written down or they've helped you with of the different side effects that you might feel, after chemo. But what's difficult sometimes is to know how bad is bad enough. For example, maybe they said, call us if you have a serious headache, or call us if you have really difficult diarrhea, or the nausea is too much for you to handle, or call us if you are feeling really hot. We'll want to know if you have that change. Well, you can see each of those things is kind of qualitative. How much is too bad? How bad of a headache does it need to be for you to make that call? So generally, the best rule of thumb is call. Even though, as you saw, they are busy, they have very busy days, they are also ready and expecting your calls to make sure that everything is okay while you're in between treatments. So if you've gone home and you are dealing with the side effect, then this is a good idea to give them a call. Let's say you begin to break out in a rash. Well, maybe in the past you've had a rash when you've been nervous. You're not sure if this is nerves or this is the chemo. Great time to call the office, call the nurse. They'd much rather have you call and handle things before they either worsen or set your fears aside so that you'll be comforted that it's nothing to worry about. They'd much rather you call for that. At times, with certain chemos, there are even some medications that you can take, but they may not address that until you actually have the side effect. So the when is always, whenever you have a question, never to worry. I've never heard a chemo nurse complain that someone has called. It's always to err on the side of calling them. Between treatment times is also a great time to stay in touch with your dietitian and your counselor. There are a lot of things that can be done to help certain side effects of chemo with your diet, for example. So just because you have started chemotherapy treatment doesn't mean you've dropped off from the other people who are helping you. Stay in contact with the dietitian, stay in contact with a counselor. And if you have taken someone with you to chemo, this is another great time to use them because they would have heard also from the nurses when the good times, important times are for you to call the nurse in between treatments. So if you're wondering, it probably means you do need to call. And after all, that's why they're there, to take care of you and your health.